if somebody is to kind of start taking on a more nutritarian diet, um, and this came up when I was doing a bit of research, and people wondering whether if they start a nutritarian diet at let's say my age, for instance, like 32, that would it be able to kind of prevent or at least try to reverse diseases such as cancers, as obviously if not that someone has one, but obviously there could be a prevalence these days towards it from a dietary pattern that they've had in the past. But eating a more nutrient dense nutritarian diet, does that then reverse it? Or as well, if they did have cancer, for instance, is it able to help, at least alleviate and try to reverse that way as well?
Yes, and that's the point I'm making. The point I'm making is that if you live in a manner like other people live, where their diet is mostly processed foods and animal products, because the American diet and most of European countries are eating 60% of calories from processed foods, and I include oils and white and flour products as processed foods. Breads and bagels and croissants and baked goods are all processed foods. And they eat about 30%, 35% animal products, and they eat less than 10% produce. So we're talking here about most people, most populations eating a low amount of plant produce, which is then going to, that combination, that dietary portfolio is going to make it so people develop cancer cells in their body, and cells that could be develop changes, precancerous conditions that cumulatively eventually lead to cancer. Genetic broken DNA crosslinks, methylation defects, epigenetic changes. In other words, we accumulate damage to the cell that over time leads to a cell eventually becoming a cancerous cell where replication is more uncontrolled, right? And
Mm-hmm.
so I'm saying right now is that if we look at in the United States, for example, most people over the age of 70 will have cancer cells in their body, somewhere in their body, right? And even at a younger age, we're having a lot of people with cancerous cells in their body. And yes, the answer is if you smoke cigarettes for 20 years and you quit smoking, after 20 years of being off cigarettes, your risk of going lung cancer is going to decrease every year off the cigarettes, to the point after being 20 years off cigarettes, particularly if you eat healthfully, your risk of lung cancer can get pretty low but you still have a small risk of lung cancer from your years of smoking, but the risk will go down if you ate healthy and stayed off the cigarettes for a longer period of time. The longer you're off the cigarettes, the more your risk goes down. It's the same thing with food. You can cause damage in your youth, and you can cause damage to the DNA that would predispose the cell to cancer. But every year you change that damage and start eating healthfully and you stay away from those cancer promoting substances, your risk would go down. And yes, definitely the whole point of a nutritarian diet is that people haven't eaten healthfully there very often for the first 30 or 40 years of their life. And they can't just make moderate changes to expect the body to repair broken crosslinks and methylation defects. They have to eat a diet of nutritional excellence. They have to learn about this, because then the body has the immune system potential to be able to repair and heal and put back to normal things that were defective that could eventually lead to cancer if not addressed. And that's where I'm such an advocate of going all the way to such healthy eating, especially of people who've lived unhealthily for decades, to give their body a chance to really get their health back. You can't do that by just improving your diet. You have to really eat a diet that has nutritional excellence in it. And then we test that out with people who have had cancer. Like we could monitor a lot of men with prostate cancer. And my experience has been that a lot of men with early stage prostate cancer, it's easy to measure them with their PSAs going up, that we see their PSAs level off and then go down again, that we see this as a reversible condition. And Dr. Ornish has documented the same thing in his study on reversible prostate cancer. And I've seen that in my practice for decades. And I've had a lot of exposure to women with breast cancer whose conditions were able to either stop progressing or not result in death. I'll give you a couple of examples, okay? One woman had metastatic ovarian cancer with 4 liters of fluid in her chest, in her lung, from a collapsed lung. And she obviously, it was a very aggressive cancer, so she had to do chemotherapy. But with the chemotherapy, doesn't kill every cancerous cell. Some stray cells survive and come back and kill the person a year or two later. And this person's now alive more than 25 years later, because the immune support she got from eating so healthfully enabled the body to seek out and destroy the occasional stray cell that may have escaped her chemo. Because it's not normal to see this person survive for 25 years and not get a recurrence of the cancer. The same thing is true with my, let's say, sister-in-law who had a very aggressive metastatic breast cancer when she was young. And because that cancer was aggressive, it would have killed her without the chemo, because chemo kills an aggressive cancer more better than an indolent cancer. Slow-growing cancers like garden variety breast cancer or prostate cancer are so slow-growing that cancer doesn't kill the cells that effectively because they're not replicating quickly enough. It doesn't differentiate the cancer cell from the abnormal cell sufficiently. But when you have a rapidly aggressive cancer that's replicating rapidly, it exposes its DNA. It makes it more susceptible to the effects of chemo. So in that case, chemo was needed. But the expectation is that 5-year, 10-year survival is still not going to be great in these cases because obviously some of these aggressive cancer cells escape the initial treatment and can come back and kill the person. And likewise, and these people are now, living 20 years later. So I have many people with metastatic breast cancer and ovarian cancer and more aggressive cancers who, whether they needed treatment or not, they still haven't had recurrence of the cancers. And people with slow-growing and early-stage breast cancers and prostate cancer who never needed chemo and just followed the diet and it went away. So we do see that there's tremendous potential of dietary excellence to modulate that, and that we have a lot of evidence within scientific studies as well. For example, one study followed women with breast cancer for 10 years, and they tracked the amount of lignans they ate. Lignans, you can get 7 milligrams of lignin from a teaspoon of flax seeds. And these people ate less than half a milligram of lignin, had a 71 reduced risk of breast cancer deaths over that 10-year period that they were followed, compared to women who hardly ate any lignin, right? And that was only half a milligram, and you could eat 7. So we're saying here that was factoring just one, we're looking at one variable there, the amount of lignin they're eating. But we're not doing that. We're giving them more lignans at a younger age. We're giving them a lot of different phytochemicals, not just giving them flax seeds, but giving them green vegetables and onions and mushrooms and berries and pomegranate. We're giving a whole lot of things. And each one of those interventions have been shown to reduce rates of cancers and death from cancer in people who have cancer. So yes, we can put together a dietary portfolio with a lot of these anti-cancer foods to work synergistically to support the immune recognition, so the body can recognize abnormal cells and cause apoptosis or death of those cells to prevent cancer from being a problem. And that's innate in the body's immune system when your immune system is functioning normally. So yes, that's one of the reasons people follow a Nutritarian diet, because people always say, well, I'll eat healthfully, but not that healthy. And I'm saying, you know what? It's not worth eating 10% of garbage. You might as well just eat all the way, because you don't even like the garbage after a while. It doesn't make you feel well. And you can make the healthy food taste good. And there's no reason why we should self-destruct even part of the time. Let's just go all the way and eat healthy and just live on a healthy diet. And we can live without fear. We can live with more confidence. We can live with more, much better health in our later years, even whether we get cancer or not. We feel better, we feel younger, and we're able to enjoy our life more as we age when you're in good health.
I completely agree with that, because I think as well with like you mentioning that obviously eating 90% healthy and then at 10% maybe a bit of junk once in a while. I feel that now. Like if I then stray off and have a slice of pizza, I feel like shit for a few days afterwards. Like in comparison to eating very whole foods for the rest of the time. And it just does me in.
Was it worth it? Was it worth it to be up all night drinking water and having a dry mouth and feeling bad? Was that pizza really worth it? When I could have, you could have had something healthy that was also enjoyable.
Yeah, it's never worth it. Like at the time, you feel like it might be, but it never is.
Yeah, right.
And I think as well, there's a lot of people will be like, hey, like cancer's in my genetics, but also I've come to realize in later years that genes don't have to be the outcome. It's what you eat is going to upregulate and downregulate your gene expression for like your potential health outcomes as well. So although it may be, genetic in some way, shape or form, and it's not always, like you then have the power to kind of upregulate and downregulate the outcome of what's going to happen.
Right. The genes are a very minor point here, because your body has the ability to turn on and turn off genes accordingly. So it's called gene silencing. Your body can turn off abnormal genes that increase risk. And we're obviously the body. So what I'm saying is that our genes are more what we eat, not what we inherit. And, but however, there are cases where the genes can be damaged in utero, or even the eggs can be damaged in the woman's body before she even conceives, before the egg is fertilized. So we're saying, so some, for example, in other words, acute blastocytic leukemia that can occur in the first 3 years of life can be linked to the consumption of luncheon meats and even the lack of green vegetables in the mother's diet, not just during pregnancy, but also prior to conception. What I'm saying right now is that even the things that we think are inherited are not really in our genes. It's still a result of unhealthy eating. It's just your parents ate the unhealthy diet, or your mother did, that damaged the genes that were then passed on to you. And if all of society would improve their health and their exposure to eat healthfully, we'd have much less, we'd inherit a much healthier babies, and children would be have better genes if the parents ate healthier too. You follow me?
I do, absolutely. And I think, yeah, like I think having help, like people need to start looking at their future outcomes. So whether they're like planning on having children, for instance,
Yeah.
starting to eat a healthier diet, or like if you're not going to go the whole entire way, at least go as much as you physically can. It's going to have better outcomes for the generations below you as well.
Right. And when we're a green vegetable dependent animal, we need a large exposure to green foods. And people are eating, obviously, too much grain and processed flours and things. And even on plant-based diets, they're not eating enough green vegetables.